The title of my talk is Staying Active with Hand and Wrist Pain. So who am I? I'm a hand and upper extremity specialist. So I'm trained in orthopedic surgery. I did my residency at Mayo Clinic and then did fellowship in hand surgery at Baylor College of Medicine in Houston. And now I'm here. So like you, I like to stay active. I love hiking, skiing, taking my kids out biking. My biking is more the indoor type, but I live an active lifestyle, and that's why we love Colorado. So now I'd like to know who you are. Tell me in the comments, tell me what kinds of things you love to do. Let me know what has been bothering you or what questions I might be able to answer. But I'll take a few educated guesses about who you are. Like most of my patients, I'm guessing you want to maintain an active and healthy lifestyle. You also probably do your homework and you come to the office very well informed. And you're not ready to give in and stop your activities because of pain. So that's why people come and see me. So here's the agenda. In part 1, I'll be going over some common causes of hand and wrist pain. And then I'll give you some easy changes that you can make to help relieve that pain. And I'll also go over some red flags and some ideas of when you should see a doctor. Then in part 2, Bridget, our physical therapist, is going to be going over some tips for people for body mechanics. So I know lots of you are newly working at home, or maybe you haven't set up your office properly yet. And so this is going to be full of ideas for you to set up your workspace properly so that you don't create chronic pain. So let's start by going over common causes of hand and wrist pain. I would characterize these into the following categories. You can have pain from fractures. You can have pain from arthritis, tendinitis, and nerve damage. So those are the main categories that I see people having wrist and hand pain. But of course, if you have a fracture, most of you know it, and you go into the hospital to get x-rays and get that evaluated. So let's go over some of these other causes that can lead to sort of less obvious causes of hand and wrist pain. So what is arthritis? All joints in the body are lined with cartilage, and it's a very special kind of hyaline cartilage. It's the slipperiest surface that is known to man. So we've never been able to create a synthetic surface that has the same level of the same coefficient of friction as cartilage. So just to give you an example, if you have a contact force of 225 pounds, so a large adult person, that produces a shear force of just 0.45 pounds in the knee, for example, or 2 newtons. So the cartilage is a very slippery and well lubricated surface. When you get wearing out of the cartilage, that can be due to changes in your joint mechanics, tearing of ligaments, or instability in the joint. Then you get this picture that you see here on the right, where this is actually bone showing through the cartilage. And that's what arthritis looks like, where you've worn away so much cartilage that you actually have bone, bits of bone rubbing against bone instead of cartilage on cartilage. So as I mentioned, arthritis can be caused by old injuries. So you physically damage the cartilage cells and then they die and they don't repair themselves. You can also get arthritis because of lax ligaments, which would cause changes in the joint mechanics. And then hard work and a life well lived is kind of what I tell people that is what's causing their arthritis. So if you have lots of force going through a joint, for example, this is a picture of the thumb base, which sees quite a bit of force with any kind of pinching and gripping at the tip of the finger. You can see in stage 1, we just get narrowing of the joint space here. Stage 2, thumb arthritis, you're starting to get extra bone growth, osteophytes, and much more narrowing. Stage 3, you can see the joint is starting to slip out of alignment. We have a bigger osteophyte and less cartilage. And then stage 4, it starts to spread to some of the other joints. That change in the load, the change in mechanics can cause arthritis in adjacent joints. So what does arthritis feel like? Arthritis usually presents as pain with activities and weight bearing, and it is improved with rest. Arthritis feels worse at the end of the day, and sometimes it can flare up and just feel sore all the time. So it's not uncommon that I'll see a patient who comes in with hand or wrist pain and they say, well, you know, I had a weekend of gardening, I planted all my tulip bulbs, and now I'm really, really sore. I must have hurt myself. When in fact, what happened was they had underlying arthritis that was not very symptomatic. that then after such intense activity became symptomatic. And so it's really its underlying arthritis that has been the cause of pain at times like that. So what are some common patterns of arthritis? So we talked briefly about thumb-based arthritis, and here are a few x-rays to kind of show you this is a normal thumb here on the left. We've got kind of that stage 2 arthritis where you're slipping out of the joint. You may have the beginnings of an osteophyte. You've got some narrowing of the joint space. And then here, this is end-stage arthritis where you can see on the right, lots of osteophytes. You have elimination of that joint space. You have the whiteness, we call that subchondral sclerosis, where the bone actually thickens where it's being rubbed. And then the other thing I would point out about thumb arthritis is that here between the thumb and the index finger metacarpal bones, you have this nice V shape, and that's normal. But as the arthritis progresses, those metacarpals become more parallel. And in turn, in order to get the hand and the thumb around any object for grasping, you end up with compensatory hyperextension of the next joint, the first thumb knuckle. And that will lead to arthritis in that joint as well and can lead to some instability there. I do very commonly see arthritis in the finger joints. So this x-ray is showing you again, we lost the joint space. There's white, thick sclerotic bone. There's no more cartilage and there's extra bone growing on the sides. And then here on the right, this is a common condition that is usually associated with arthritis. This is called a mucus cyst or a ganglion cyst. And what it is the joint is making extra fluid in reaction to the arthritis. And there's a little weak spot in the capsule that ends up allowing this little bubble of joint fluid to come out. And this is a photograph of what that looks like. Another common cause of arthritis are old injuries. So here on the left, we have a scaphoid fracture. This bone here is called the scaphoid. This was never treated and didn't heal up, and that changes the wrist mechanics fairly significantly. On the right, we have a similar injury where it's not a fracture, it's actually a ligament sprain that was never properly treated. And over time, you get the same pattern of arthritis where the radius wears out underneath that scaphoid bone. So you can see that the joint has worn out underneath that scaphoid bone. And again, you see extra bone growth, osteophytes. You see thickening of the bone, which makes it look more white. And you also see a loss of the cartilage space. But the cartilage is actually maintained under the neighboring bone, the lunate bone. So let's move on to tendinitis. So those are some common causes of arthritis. Let's move on to tendinitis. So tendons are the soft tissue which connects muscle and bone. So the tendons are the ropes that allow the muscle to power the joints and move the joints. Repetitive activities can cause micro damage within the tendon, and sometimes where it attaches to the bone is the location of that micro damage. And tendinitis can also happen when tendons glide through very tight spaces. And I'll show you an example of that in just a minute. Tendinitis results in swelling, pain. It may feel very sharp or very intense. It could also present as very mild pain. Tendinitis also tends to be worse with activities, and it may progress to where it hurts all the time. So let's look at a few common patterns of tendinitis. This video is a common tendinitis that I see called a trigger finger. So when she opens her finger, snap, that tendon is thickened and it doesn't glide very smoothly. And so you see snapping in the fingers. This is an illustration of what trigger fingers look like. So we all have long tendons in the hand that go out to the end of the fingertips, and the tendons glide through this little fibroosseous sheath. These are called pulleys because they act like pulleys, where they change the direction of force that is being exerted by the pull of the tendon. So at the entrance of that pulley channel, the tendon can actually rub on the edge of the pulley. And if you can imagine a rope going around a corner, if it rubs back and forth, it will fray. Well, the tendon is the rope in this situation, but instead of fraying, it just swells up. The pulley is also living tissue, and so it also swells. And now you have a narrow channel and a thick tendon, and eventually that tendon doesn't fit very well through that narrow channel. The snapping that you see in a trigger finger is this little swollen piece of tendon snapping underneath, back and forth as the finger opens and closes underneath that first pulley. De Quervains is another type of tendinitis where the tendons of the thumb are actually sliding through a similar pulley system here at the wrist. And when those tendons get thickened, it can be quite painful. You don't usually see the same kind of snapping that you would see with a trigger finger, but that can be very painful on that thumb side of the wrist. Tennis elbow is also a very common type of tendinitis, but tennis elbow is actually, it's a degenerative process and not an inflammatory process. So that makes it a little bit different. So we think that what is happening in tennis elbow is that the tendon is getting micro damage right at the elbow where it attaches to the bone, but then something goes wrong with the reparative signal. So instead of repairing and going, growing healthy new tissue, it actually starts to degenerate and break down. And so you see, if we send this tissue for pathology, you end up seeing really disorganized fibers that are not healing. There's new nerve ingrowth. Those nerves and disorganized blood vessels release painful substances. So they release glutamate, substance P, bradykinins, and prostaglandins. Those are all basically substances that impede healing and cause lots of pain. So that's what tennis elbow is. It's a little bit different process. Let's move on now to nerve problems. So nerve damage can happen at any point along the course of a nerve. Nerves run obviously from the brain through the spinal cord, out these little holes in the spine called neural foramen, and then they join together in the brachial plexus to create the peripheral nerves. So outside past the shoulder, we get what's called the median nerve. And if that gets pinched along its course, that will cause pain, numbness, and tingling. It can sometimes cause weakness as well. So here are a few common patterns of nerve damage. The first is carpal tunnel syndrome. And I'm guessing you guys have heard of carpal tunnel syndrome. So here in the wrist, this is on the palm side of the wrist, there's actually a strong ligament that connects the arch of bones that go over the back of the wrist. And that creates sort of what we call the floor of the carpal tunnel. Underneath that thick ligament, you have 10 structures. You have 9 tendons and then 1 nerve. Anytime that those tendons get irritated, they get thickened, there's any swelling in the tendons in the carpal tunnel, the softest thing in that tunnel is the nerve, and that's what ends up getting squished. So carpal tunnel syndrome is numbness and tingling in the thumb, index, middle, and sometimes part of the ring finger. It can wake a person up at night, make them feel like they have to shake their hands. Their hand feels like it fell asleep. It can even happen during the daytime when you're doing things like driving or talking on the phone. So it's caused by compression of the nerve. Similarly, there's another syndrome called cubital tunnel syndrome, and it's a very similar process, but it's a different nerve. It's the nerve that gives you sensation to the small finger and the ring finger, and it also powers a lot of the intrinsic muscles in the hand, so things that give you your grip strength and help you bend your fingers down for fine motor skills. The most common site for ulnar nerve compression, which is also called the funny bone nerve, it's the same nerve that gives you that tingling and pain if you knock your elbow. It's at the elbow in the cubital tunnel. So those are some common causes of hand and wrist pain. Let's go over some tips for how to stay active if these things are affecting you. So the first idea that I have for you is to modify your hand position. So if it hurts to bear weight through a hand on the floor, for example, in push-up position, you can bear weight through your elbows, like this lady on the left, or you can even use grip assistance to keep your wrist in a more neutral position, like the woman on the right. You can also modify your grip when you're doing things like bike riding. So these recumbent bikes or more upright bikes will take the weight off of your hands and transfer that back into your back and legs. Here in the front on the left, you see some aero bar grips where you're leaning on your elbows and keeping your hands in neutral, and that can be much more comfortable. Of course, you do have to be able to take your hands away to shift and brake. The next idea that I have for you is to add support. So wearing a wrist brace or using straps if you're lifting heavy weights that are too painful to lift can be very helpful to keep you going with your activities, even if your grip is not quite strong enough for the weight that the rest of your body can lift. Here are a few other ways to add support. So these braces are all intended for thumb arthritis. So they're, some are longer, some are shorter, some are lower profile. All of these will give you a little bit of support at the base of the thumb and can be very helpful if you have pain from thumb arthritis. Another tip is to add padding. So here I have a picture of some gel padded gloves for biking. They have, thick padding that is not, in small little spots so that it can fit you, because these are not custom made gloves. So you just want to make sure that the padding is where you need it. And then here on the right, I've got a picture of an elbow pad, which can be helpful if you get numbness and tingling in your small and ring fingers. It can just keep the weight off of that nerve, prevent you from hitting your elbow and getting that funny bone feeling if that's been a problem for you. Another idea is to practice joint conservation. So instead of carrying your bags in a painful hand or wrist, shift the weight up the arm so that you're carrying it on the forearm or at the elbow, or if you have a shoulder strap. All of that can take some of the weight away from the hand and the wrist and transfer it to a larger joint. That can kind of preserve the joint so that it doesn't get so painful, and you can use it in the activities that matter most to you. There are also some really helpful tools. So if you have arthritis or weakness of your grip, you can use jar openers. If you put grips on pens and pencils, that will reduce the amount of strain that you get at the base of the thumb. And then also these doorknob and key grips can help to transfer the load from the thumb to other parts of the hand that may be less painful. Let's talk also about care of injuries. So here are some ideas for basic orthopedic first aid. We have the acronym RICE, which stands for rest, ice, compression, and elevation. So if you get back from a run and you've got pain in your ankle or your knee, this will help. So you want to rest until it doesn't hurt anymore. Applying ice first before heat. So maybe you're tempted to get into a hot shower or a hot tub, but ice first to help get some of the swelling down. Using compression will also help reduce swelling and can reduce pain. And then finally, elevation is good for helping with swelling. I also often recommend a short course of non-steroidal anti-inflammatories. So those are medications like Advil or Tylenol. Advil and Tylenol can be mixed together. Other medicines such as Aleve, ibuprofen, and Advil should not be mixed together because they're too closely related. But taking a short course of 3 or 4 days of taking those medicines on schedule according to the instructions on the bottle, that can help calm down pain and inflammation, maybe keep you out of the doctor's office. When should you see a doctor? So anytime you have pain waking you up at night, it's important to come in because that's not normal and it can be a red flag. Pain that is keeping you from doing activities that you love. None of us has time to waste. You might as well just come in and get it checked out. If the basics of RICE and over-the-counter medications is not working for you, there's no need to wait months and months. Just come in and we'll see what we can do for you. If you've fallen or had a traumatic injury, if you've fallen off a bike, if there's any kind of energy behind that fall, you should probably come in and get an x-ray. And then any pain that's lasting more than 2 weeks may be something more serious, and so that's worth checking out. Finally, any nerve symptoms such as numbness, tingling, weakness, new onset weakness, those are all reasons to be seen by a physician. Finally, I've got some tips on how to avoid or delay surgery. So always start with getting the right diagnosis so that you can have a conversation about how urgent is it to do surgery, what will happen if you wait, and then what are your other options. I find myself sending people to physical therapy and hand therapy often, and it can be helpful and can be the definitive treatment for many of these conditions that we've talked about. Using appropriate splinting and bracing can go a long way toward alleviating pain, and steroid injections can also be very helpful. I'm often asked by my patients, well, aren't steroid injections just a Band-Aid? Aren't they all just temporary relief? And that's true in certain situations. But in some cases, steroid injections can cure the condition. And so it's worth finding out if a steroid injection is curative or if it is meant for symptomatic relief only. So in many cases, even if they are temporary, they can allow you to delay surgical intervention until you're ready or until there's a better time in your life to do it and still be able to do the activities that you love. Here are a few thoughts if you're considering having surgery, a few questions to ask your doctor. Well, ask, can I put this off? Can I delay it? What will happen if I do? What happens if I just never have surgery? And finally, is this your area of expertise? What's the recovery like? You need to make sure that you can go through with the full recovery and do all the therapy if that's needed. Will I be able to return to all of my activities, or is this something that is going to change my abilities for the rest of my life? And then how do you address postoperative pain? I think is an important conversation to have if you're thinking about doing surgery. Here's a little bit about my practice. I am a hand and upper extremity specialist, so I see patients with problems from the elbow to the fingertips. I have expertise in fracture care, joint replacements, tendon surgery, nerve surgery, and I offer you very personalized care. So you're always going to see me when you have an appointment with me. I spend a lot of time with you, and educating you on the options is my priority so that we come up with a plan that works for your lifestyle. Now I'm going to hand it over to Bridget, and she's going to go over some tips and ideas for avoiding pain with body mechanics.
I'm Bridget Myers. I'm a physical therapist here at Boulder Center for Orthopedics and Spine. I'm going to speak a bit today about body mechanics, and it's really important. Dr. Kollitz talked a bit about this, but it's really what you do every day that can help or hinder your body. Just to give a little background information on me, I'm a doctor of physical therapy. I graduated from Regis University in 2007. I've been treating individuals in orthopedics for more than 13 years, and I specialize in upper extremity and lower extremity injuries and impairments. So I thought I'd talk a bit about what do physical therapists do. We really treat not just your injury, but it's really important to look at the whole chain. So really, for instance, if you have, say, an ankle injury, I think it's really important not just to look at the ankle, which of course we'll do, but also look at the whole line and chain. So we're going to look at like your gait, how you're standing, what you have in terms of impairments. Also looking at issues like if you're strong in your glutes and your hamstrings and your core and things of that nature. So it's really going to be important to kind of look at that whole chain. Once we do that, then it's really important to really focus on an individualized treatment plan and really look at what your goals are. And obviously we're going to try and decrease the pain and increase your function, but really I think ultimately it's to try and restore what you want to do in living. As part of it, we'll really look at that evaluation. We'll look at your history, how this injury was actually caused, any previous injuries or surgeries, and then really what aggravates your symptoms is going to be really important as far as that goes. We're also going to look at what we can do to kind of help with that impairment and help with that function, how it works towards not only your ADLs, but as I said previously, how you really function in life and what you want to get back to doing. So I thought I'd talk a little bit about what we do see in the clinic. We see a lot of different issues, and this by no means is comprehensive, but it's really important to look at a whole myriad of different issues. So anything from looking at sprains and strains to post-op rehab. So of course we look at sitting today. We all are in front of Zoom. Our kids are in front of the computer for 6 hours a day. And so I think it's really important to have a proper positioning with your computer setup. And we'll talk a bit about that, as well as some activities that you can do to help with our overall body mechanics. So for instance, having a proper computer setup is key. We're all on laptops right now, and so it's really important to adjust your keyboard so your shoulders can stay relaxed and are allowed to sit at your side. Your forearm should be parallel to the floor and have about a 90-degree angle at the elbow. The mouse, if you have one, should be placed adjacent to the keyboard and at the same height of the keyboard, so you don't have to basically look and reach way off to the side. Be careful also because we have a lot of mouse pads, so that causes a lot of thumb and finger issues and overextension issues. So be aware of those. If you look at centering the monitor, that's important. If you have multiple monitors, really try to focus and not try to overly eliminate twisting or straining your neck with that. Again, positioning the monitor at that eye height position is ideal. A lot of us have those laptops, so we need to get them up and away from the lower desk. If you can put your laptop on something that will really help you, that would be great. If you do wear bifocals, that's the one time you do want to lower the monitor down so it's comfortable so you don't have that eye strain. And again, sitting at a proper distance and not having to overly reach for the mouse or for the keyboard is important. Yes, the slump. So to avoid the turtleneck position with our heads forward and our shoulders are forward, what we're wanting to have people do is really to try and keep your shoulders more in line with your ears rather than slump way forward and have the turtleneck. So I'm going to turn sideways. One of the things I recommend people do is just do a chin tuck position. So you're going to take your chin and gently put it towards your throat. And that's a great thing to do multiple times a day. So I like to call that chin tuck position. So if you can do that 5 or 10 times, several times, that will really help with that position. And then if you don't have a good lumbar support, it's really important to have some support of some sort behind your back. So what I suggest doing is placing a towel at the low of your back, and that will really help with that sitting posture. Or what you can do is kind of scoot yourself forward and actually sit at the edge of the seat with your legs wide and your back will be straight. And that's a really comfortable position that you don't have to strain. I really encourage people when they are at the computer to take a 5-minute break and push yourself away, do some stretching, which we'll talk about in a second, and make sure you're drinking plenty of water. We also recommend doing an eye exercise where, you know, every 20 minutes you take a few moments to look away from your computer for 20 seconds, because otherwise things start getting kind of blurry and things of that nature. So this is one of my favorite things that I give my patients to do is some neck stretching. It's very simple. So you're just going to drop your ear to the side gently and you'll hold for 10 seconds and then keep that position and look down towards your armpit or towards the floor and hold that for 10 seconds. And then you'll look up to the sky with your head to the side for about 10 seconds. The idea is then you're stretching the front, the side, and the back of your neck, and be sure to do both sides. I encourage people to do that 2 or 3 times a day at least. Another favorite posture position I have is to actually do what's called a posture stretch at the wall. And basically you're going to stand against a wall. You're going to place your knuckles, your hips, your shoulders, and hopefully the back of your head to the wall, and just stand there for 60 seconds. And I encourage people to do that twice a day, and that really opens up your chest, and that's going to be super important. We tend to slump forward and gravity takes hold. So that's a good posture stretch to be aware of. Another great stretch is a corner stretch. So just find a corner and then step 1 foot forward, and you're going to put your arms in a goal post position, and then try and hold there for 30 seconds and do that 2 to 3 times a day. Or you can do this at the doorway as well. And it's a really comfortable thing. You should feel a nice stretch in your chest. You shouldn't feel any strain or pain in your shoulders. If you do feel some sort of issue with your shoulders, then simply drop those shoulders down and the elbows down, and that should help a bit. Scapular squeezes. So what you're trying to do is squeeze those shoulders back and down. I like to tell people, pretend you have a pen or a pencil in between your shoulder blades, and then try to squeeze those routinely 10 times every hour is a great one. I also encourage people to really focus on tucking their tummy in. So squeeze your belly button in towards your spine, much like if you had a too tight pair of jeans and you needed to zip up. And that is a huge important activity to do every hour. Another good one, I don't know if you can see me or not, but basically I like to do a hand clasp position. So where you're going to stretch those arms out behind your back. Another option is bringing those that way, and then just put your hands on the back of your hips and then squeeze those elbows together. Is a great simple exercise, and you don't need a wall or anything. For a hand or a forearm stretch, since we're at the computer a lot, what you're going to do is basically use that hand to drop that down. I want you to be careful of that shoulder. That shoulder likes to rise up. So instead, you're really going to focus on stretching that without keeping that shoulder elevated. And then you can flip your hand over, and then the fingers are going down towards the ground and still dropping that shoulder down. And that's a great one to do. I'd like to talk a bit about just lifting in general because it's really important. We tend to lift a lot and we see a lot of strains and back issues here in the clinic. So if you can prevent your back from doing all the work, that would be great. So one of the key postures to do is get close to the load. Get as close as possible, have your legs nice and wide, and really bend over using your legs to pick that object up. So when you do go to lift, you're going to want to really keep yourself in that upright position and lift with those legs. And the important thing is to turn your body with your feet first and not twist. A lot of people say snow shovel, things like that really tend to overutilize their twisting motion, and that does no good for the back. So if you can, really focus on twisting by pivoting with your feet first. And then, of course, asking for help. A lot of people tend to lift a too heavy object alone, and then we see them here in the clinic. So to avoid that, do ask for help. So I really focus on people not just using proper body mechanics, but really working on strengthening for long-term gains and to avoid overuse and strains. So where you want to focus, of course, is your core, your back, your shoulders, and your legs. And again, keep moving. Being at that computer in that slump position for a prolonged period of time without moving can be detrimental. And we see it here in the clinic all the time. But if you do end up having some issues and things like that, we really do appreciate you calling us and letting us help you with that. Here at Boulder Center for Orthopedics in the physical therapy department, we have a very unique comprehensive care plan with the physicians. We have physical therapists that are very skilled in the entire body, including hand, wrist, shoulder, elbow, back, neck, knee, ankle. Our goal is, of course, to get you back to healing fully and get you back to your active lifestyle that we have here in Colorado. This is just a few of the things that we offer here at Boulder Center for Orthopedics Physical Therapy. We do have a comprehensive rehabilitative program, so that's just a myriad of a few of the things that we offer. This is just a couple suggestions. There's a brochure that's really good from NIH. There's my bio if you wanted more information, and that's our website if you'd like to check us out. Thank you.